Hi, Dr. Becca here with Del Mar Center for Behavioral Health. I wanted to take a moment today to talk about curriculum and assessment. So an assessment and a curriculum are both important parts of your child's intervention program, and that can be intervention like behavior analysis. It can be interventions such as occupational therapy, speech language therapy, and it also relates to education. So traditional school, and both are important, and yet they are not the same thing, and I think that that is an important distinction to make. So an assessment is really a snapshot of skills. It's done once in a certain chunk of time or twice in a certain chunk of time to determine what skills are mastered and what skills are not yet mastered or within the learner's repertoire or established skills or behaviors. So you can think about the SAT, let's say, as an assessment. It is a measure that assesses a wide variety of skills and then gives you an overall score, and that score sort of compares you to other people's knowledge on the same skills. A curriculum is somewhat different. So a curriculum is really a way of teaching skills that build on each other. So once you've mastered single digit addition, then we move on to double digit addition, and then we move on to the next step. And maybe even before single digit addition, we're looking at making sure that the individual or the learner knows what one-to-one correspondence is. And so it's this idea that these skills build on each other. And once one skill is built, we move on to the next and then on to the next. And so a curriculum may or may not come with an assessment. So an assessment that's used frequently in behavior analysis is called the VB map, and it looks at verbal behavior milestones and barriers to development of verbal behavior. And it is an assessment. It will tell you what skills the learner has already mastered and what skills they haven't yet mastered. And by giving that assessment periodically, we're able to measure growth. Of course, in behavior analysis, we're also taking data daily, minutely, if that's even a word, and so we're constantly assessing growth in that way, but an assessment is a snapshot, and so when we put a bunch of snapshots together, we can see, sort of tell a story, or we can see data over time. But when we complete that VB map assessment, it doesn't give us a curriculum to teach from. And so we use PEAK as a curriculum, which we'll have another video about PEAK. But PEAK has an assessment component and a curriculum. So we conduct the assessment or the pre-assessment that tells us what skills the learner has mastered or hasn't yet mastered. And then based on the results from that assessment, we go to the corresponding curriculum, and that helps us select goals. So we are using a related and complementary assessment that then we can go back to the curriculum and select goals, and so the two work together in conjunction. This is kind of the idea between some of the standard course of study, right? So there might be an end of grade test, which is an assessment that or even benchmarks that are given at the beginning, the middle, and the end of the year. But those are assessments, they are not curriculum. And so then after you give the assessment, then different schools may all use the same end of grade test, right, or the same benchmarks, but they're using different curriculum to teach the material. And so it's important that we're using both assessment and curricula, and that we're not taking an assessment and turning it into a curriculum. So one of the things that can happen is if we take a test, let's say the SAT, and I'm only teaching you what is on the test, then that's where the language teach to the test comes from. And it means that you'll do really well on that test, but that doesn't necessarily generalize to other settings or other materials or other skills that you might need to know. It means that you'll do really well on the SAT, but how well does the SAT mimic or represent the skills that are needed in daily life? If I remember, there's like algebra and geometry on there, and I don't know the last time I've solved for X unless it was to help a kiddo for homework. So it's really important that we are not using assessment as curriculum, and that we have both assessment and curricula in place to help our learners take steps towards their goals. So we don't want to take an assessment and then create goals just from that assessment, because then we're just teaching to the test, and that test may not be representative of everything that an individual needs to know how to do. And they are both important components of any intervention program. Our speech language pathologist uses assessments to identify where a child is related to their speech skills and language skills, and then based on the results from that assessment, she will select a curriculum that best matches the child's needs, or strategies to best match that child's needs, and will then periodically use that assessment to we'll re-administer that assessment to check for progress and growth. So I hope this was helpful. If you have any other questions about assessment or curriculum, be happy to talk more about those. And thanks for taking 6 minutes and tuning in, and I hope this was helpful. Thanks.